Hello and welcome. Today, we're diving into one of the biggest yet quietest revolutions happening inside the NHS. Now, this isn't about shiny new hospitals or miracle drugs. No, this is about a fundamental shift in its digital plumbing, a change that's going to affect how millions of us manage our health. So let's pull back the curtain and see how this invisible revolution is really playing out. Does this look familiar? I bet it does. For years, managing your health online was, let's be honest, a password nightmare. You had one login for your hospital, another for your GP, a totally different app for your physio. It was this whole messy patchwork of separate systems. Well, now, all of that complexity is being funneled into one single, unified front door, the NHS app. So first, let's just rewind and really unpack that old way, a system we can pretty accurately call portal chaos. You see, for more than a decade, the digital NHS wasn't one thing at all. It was this fragmented collection of separate websites or destination portals, each run by an individual hospital or trust. And as you can imagine, that created a real headache for patients.
And yeah, this slide really breaks down just how frustrating that system was. I mean, imagine you have a complex condition. You're juggling different logins, trying to navigate completely different websites, and there's no single place to see the whole picture of your care. This model put a huge amount of stress on patients, often when they were at their most vulnerable. It just wasn't working.
And this brings us to the new strategy, creating a single front door for the entire health service. NHS England has made a really decisive pivot here. They've basically decided the NHS app is going to be the one and only place patients need to go for their digital healthcare. So why did this move make so much sense? Well, it's because of this number right here. Over 32 million people were already verified users of the app, thanks in large part to the COVID pass. The audience was already there. It was this pre-built piece of national infrastructure, just sitting there, ready to be used for so much more. Okay, so how can one single app possibly do everything? This brings us to the most important idea in this whole explainer, the engine metaphor. Think of the NHS app like the dashboard of your car. You see the speedometer, the fuel gauge, but you don't build the actual engine or the gearbox, right? Specialized companies do that. Well, in this new model, the NHS app is the dashboard, and private tech companies are building the invisible engines that power everything from behind the scenes. Right, now let's pop the hood and take a look at how this all actually works. We're going to peek behind the curtain at the magic of aggregation. That's the technical process that lets one app securely pull together all your information from lots of different places. This table just lays it all out so clearly. You go from dozens of separate websites to this single NHS app, from trying to remember a million passwords to one secure NHS login. And check out the notifications. We move from expensive letters and text to push notifications that cost next to nothing. But the most profound shift? It's right there at the bottom. Tech vendors no longer sell a patient portal. They sell their ability to power the national system. That's a huge change. So when you open the app, how does it actually find your appointments? Well, it's like a 5-step dance that happens in seconds. First, you log in. The system then instantly figures out which hospitals you're registered with. It sends out a little broadcast message to each of their engines asking, hey, got any appointments for this person? The engines send the data back in a nice standard format, and boom, the app stitches it all together into one clean list for you. Simple on the surface, but pretty complex underneath. But there's a catch. Just seeing a list of appointments is one thing. What happens when you actually want to do something, like reschedule or cancel an appointment? This is where the app has to hand you over to the engine. And let's just say it isn't always a smooth ride. And this quote from a user just nails the experience. When you tap Manage Appointment, you're often deep linked out of the slick native app and into what's basically a web browser showing the engine's own software. The whole look and feel suddenly changes. It's this jarring transition that can be really confusing, and it kind of undermines that promise of a single seamless experience. So who are these companies actually building the invisible engines? In this next section, we're going to meet the engine builders. These are the tech firms that are pivoting their entire business models to become the critical but mostly unseen infrastructure providers for the NHS. Now, this isn't a monopoly. It's actually an ecosystem of specialists. You've got Doctor, who are the masters of transactions. They can connect to over 20 different hospital systems to manage bookings. Then there's Patients Know Best, or PKB, and they focus on the long-term record, storing things like your test results and care plans. And you have Induction Zesty, who specialize in the really tricky task of writing information back into the big hospital systems. They each have a very specific, very important role to play in this new machine.
Okay, so this all sounds incredibly efficient, right? But like with any massive change in architecture, there is both a payoff and a peril. So let's take a look at the clear benefits this new model brings, and then get real about the systemic risks it creates.
And the payoff is tangible and, frankly, huge. Just by switching to digital letters through the app, some of these integrations have saved 30 million sheets of paper in a single year. That is a massive win for the Greener NHS initiative. It also makes a real dent in the did not attend rate, because those push notifications and easy rescheduling options help free up incredibly valuable appointment slots.
But that's the question we absolutely have to ask. The benefits of centralizing everything are clear, but a single front door also creates a single point of failure. So what are the real dangers of building this new, highly concentrated system?
Well, this new model introduces 4 major systemic risks. First up, a single point of failure. If NHS login goes down, millions of people could be locked out of all their services at once. Then you've got data privacy, which gets way more complex as your information passes from the hospital to the engine to their own cloud providers. There's a real risk of a 2-tier system that leaves the less tech-savvy behind. And finally, if a critical appointment notification fails to arrive, who's to blame? The app, the engine, the hospital? It creates a serious accountability. So finally, let's look to the future, because this engine model isn't the end game. It's really the foundation for something much, much more ambitious, turning the NHS app from a simple reactive utility into a proactive partner in your health. The vision here is to create a super app for health. Think of something like WeChat over in Asia. It's a single application that acts as a platform or an ecosystem for dozens of different health and care services, everything from booking appointments to managing long-term conditions.
And this roadmap kind of shows the journey. We're starting now, in 2024, with integrating all the hospital appointments. But soon, we'll start to see proactive nudges for things like preventative care. By 2028, the plan is to integrate data from your wearables, like an Apple Watch. And the ultimate goal, the vision for 2030, is a unified record that even includes social care data, creating a true single view of your life and your health.
So the super app is coming. The invisible engine's already being built and switched on. But this leaves us with a final and absolutely critical question. Will this powerful new system become a truly universal engine that improves health for absolutely everyone? Or will its focus on a digital-first approach end up leaving some of the most vulnerable people in our society behind? That is the challenge the NHS has to solve.